I'm Darren Kramer.
And I'm Ann Craig. We begin with that growing concern about the deadly Ebola virus. Tonight, we're learning more about Thomas Eric Duncan's first visit to the hospital. He's a Dallas Ebola patient who died yesterday.
And now we know when he first went to the hospital, he had a temperature of 103 and told hospital officials he had been to West Africa, but he was still sent back home. This new information raising concerns tonight about how health officials are dealing with this virus.
So we wanted to know what's being done right here at home to keep you safe. So we went to local hospitals and Bradley International Airport to find out. News 8's Bob Wilson is live tonight at Hartford Hospital with what he learned today. Bob?
Well, I can tell you, Hartford Hospital is taking 100% seriously. They have all their protocols in place, and they've been using them. Matter of fact, they have already screened several travelers who've come in, been sick, been traveling. They say it is not Ebola, but they're taking every case, isolating them, going through the protocol just to make sure. And that's putting a lot of people's minds at ease, especially at Bradley International Airport. With the flights coming in today and all the Ebola rumors running around on the different airports, people are on edge.
It is very scary what's happening in Africa.
Wash your hands, try not to touch too much, stick to yourself.
I don't think I'll be touching any handrails or other things.
Travelers at Bradley International Airport are concerned. Ebola blooming in Africa, now trickling into the U.S. Passengers on a plane from New York to Las Vegas isolated at the far end of the runway because a person was vomiting on the flight. He was negative for the deadly virus, but at Bradley, people are talking about it.
You got to pay attention, listen to people coughing, sneezing, sniffling, touching things, and you just got to be aware of your surroundings.
Since we're going to be touching down in Dallas, I have hand sanitizer and we're not touching anything.
Now, we did talk to state police. Lieutenant Vance says they do have a plan. They've rehearsed it, gone over it with the airport administration, and they are ready should a case come in on an airplane. As a matter of fact, inside these cruisers in the back trunks, they do have full hazmat suits and they're ready at any time. As far as Hartford Hospital goes, they say they are ready. They've been ready for a long time, and as a matter of fact, they've even screened some patients for Ebola.
We have not had any actual cases, but we've had people who have traveled, who have been ill, and they've been immediately isolated, and then we determined that they were not at risk for Ebola.
Hartford Hospital has their isolation plan in effect, and they are ready if an actual case does make it into Bradley. But Dr. Finkelstein says the airplanes are not incubators for Ebola.
Ebola is not airborne. It's spread by direct contact with blood, vomit, diarrhea, and maybe sweat, but not airborne.
That means that you actually have to come in contact with the bodily fluid, get it in your eyes or open sore or in a pore. That's how you get it, not breathing in and out in an airplane. I'm Bob Wilson, reporting live in Hartford, News 8.